I'm Drrodrohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Welcome back to Rohrich Knows, helping you become a better and more informed you. Let's talk about something that I hear about all the time. And I just saw a patient in consultation for a revision surgery. This happened to be a revision facelift. And she was telling me that she didn't get to see her surgeon from the post-op time until about 8 weeks after her facelift. And I said, wow, that's astounding to me. So I just want to share with you from behind the scenes what I think are some 5 essentials that all patients need to know, certainly about how I practice plastic surgery. And I think the key 5 questions you need to ask, and obviously they're almost nonsensical, but like, who is doing your surgery? I mean, that is very important. And it's, you know, when I do all of my surgery on all my patients. And yes, there may be people that are assisting me or helping, but I do all of the surgery. And then where is it done? Who is doing the anesthesia? And what is my follow-up? That's what spurred me to talk about this, because the patient said, oh no, the patient could not see the surgeon for, 6 weeks after surgery. And then the other thing is how long before I can go back to work, socializing and exercise. I mean, these are all things you need to know before you go. So, of course, who is doing my surgery? Well, if a patient has traveled from around the country to see me for a revision rhinoplasty or a rhinoplasty or a facelift, of course, I'm going to be doing the surgery and no one else. And that's very powerful and very important to know that, that patient is entrusting me with their face, their nose, their body, whatever, and I'm going to be the one doing their surgery because I want to make sure they get the best result possible. And the only way you can assure that is that you do the surgery yourself, because you are the only one that can control, I think, the outcome. And certainly that's very, very important. And then I think part and parcel with that is who's doing my anesthesia. And I'm very fortunate to operate in a private practice setting. Even when I was at the university, I always had the same people doing my anesthesia. And I always have a fully trained MD that has done my anesthesia for over 25 years. It's a group, and they rotate 5 individuals, and they're all of them that I trust with me, putting me to sleep. They're fully trained. They have a high level of expertise. They do anesthesiology and do heart, liver, lung transplants at our big medical center nearby. So they are very, very comfortable managing all my patients, and all of my patients are screened preoperatively with them, and all undergo preoperative evaluation if they need it by their physician or by the anesthesiologist. So, and the other thing is they don't leave the patient, they don't leave the room, and so they're there to just monitor and make sure the patient is doing very well while I'm doing their facelift or rhinoplasty or any other procedure, because I have entrusted them with my patient, and that's very important, because they know, my patients know that if they're entrusting me to do their surgery, they want to make sure they do well and that their anesthesia is done well, and that's the only way to ensure it. I have the same staff, the same anesthesiologist for all my patients. That sounds nonsensical, but it's a reality, and there's nobody else that's going to be there. And then the other thing is really important is, where is it done? It has to be done in an accredited outpatient surgery facility. Of course, ours is an accredited Quad ASF approved facility, or it can be a Medicare approved facility, or it can be in a hospital. All these are approved, and the reason it's important is because you have the medical technology, the medical personnel, and also the medications if they're there and you need to manage any OR emergencies. Now, these are rare, but believe me, they need to be there, because just in case there is a problem. And that is so critical, because if you are in a facility that doesn't have any of these, you can be in a big problem, and you can read about those online. And you never want to be, never want to be that facility or that individual, because you want to be there to protect your patient. That is the most important thing. Protecting your patient so they can have a great and safe outcome. That is so critical. And then, what is the follow-up? Now, this is so critical to me, and then who sees me. All of my patients are scheduled and established and discussed pre-op all their follow-ups are already done. So when they come to see me from LA, I know exactly when I'm going to see them after their rhinoplasty. Their first visit is at 7 days, and then at 10 days if they need further follow-up, and then I'll let them fly home. And for a facelift, it depends on if I'm doing adjunctive things like laser resurfacing. I might see them every other or every third day to make sure they're healing well. So all of that is plotted out, and I see the patient. I see them in follow-up. I call them or text them after surgery, and they all have my cell number, and that's very important. So if there's any issue, they can call or text me. Midnight, doesn't matter. I am there for them. So this is all a regimented outcome, and this is really the reason I'm actually talking about this, because one of my patients, my future patients that I'm operating on, said, well, she wasn't allowed to see her surgeon after surgery, and I said, that's crazy. So, and then I also want to see them at 4 to 6 weeks. I either do it by FaceTime if they're out of town or out of country, and then at 3 months, 6 months, and a year. And of course, I don't charge them my post-op pays. I want to see them. I want to see how they're doing from what I did for them. So it's very important. You know, and I get texts and calls from my patients every day and every night, but it's my pleasure to do so because I committed to them as they committed to me to have me do their surgery. So it just makes sense for you to do that. And so I just wanted to share with you the behind the scenes on what, you know, a real board certified plastic surgeon that does this every day and taking care of, you know, patients from around the world does, so that you can make sure that you get best care. The best care is when you get the care from your surgeon and that they're available for you 24/7. So hopefully this will help you find a surgeon that will do something similar to this and help you become a better and more informed you, and to get you to the best surgeon with the best outcomes. So please leave me your comments and thoughts, and until next time,